Hello everyone, welcome back to Pharma Palette and welcome to another session in our Pharmacotherapy series. Have you ever seen someone suddenly become short of breath, start wheezing, or keep coughing after exposure to dust, cold air, or even while exercising? It may look like a simple breathing problem, but there's actually a lot happening inside the lungs. In today's class, we are going to understand asthma from the very beginning. We will cover what asthma is, what causes it, who is commonly affected, and how the disease develops inside the airways, its clinical features, and finally, how it is diagnosed. So, don't worry if this topic seems difficult. I will explain each concept step by step using simple language, logical flowcharts, and easy memory tricks so that you can remember it for your exams as well as for your clinical practice. So, without wasting any time, let's begin our journey into understanding asthma. So let's start the class with the definition of asthma. So usually asthma means it is a chronic inflammatory disease that usually happens in the airways, and this is having many characteristics. And to remember those characteristics, just remember one simple trick, that is MIN, where M means there is excessive mucus production in asthma and I means it is increased airway sensitivity can be seen in this, and this increased airway sensitivity we can also call it as hyper responsiveness, and N means it is narrowing of the bronchi can be seen. So a chronic inflammatory disease that usually happens in the airways, that is characterized by excessive mucus production, increased airway sensitivity, and the narrowing of bronchi is called as asthma. So coming back to the epidemiology of this asthma, so simply the people at all the ages will be affected. It can be children or it can be adult, especially the urbanization and the pollution, environmental pollution. So these have increased the prevalence in the recent decades. And coming back to the two types of asthma, one is childhood asthma, which is commonly seen in boys, and adult asthma is commonly seen in the women. And if the patient is having any kind of allergic diseases or if he is having any kind of family history of asthma, in that condition the risk of getting this asthma also increases. So great dog is the trick you need to remember, where G means it is genetic factors. So genetic factors like family history or atopy conditions can lead to asthma. Here atopy means it is simply the allergic tendency. Next one is R, which is respiratory infections, that can be viral infections or any kind of childhood infections. And next one is E, which is environmental pollution. So it can be because of air or cigarette smoke or any kind of dust and strong odors can lead to this. And next one is A, which means it is allergens. So those allergens can be pollen, dust, or mitts. Then we have T, which is temperature and exercise. So cold air, weather changes, and the heavy exercises can also cause this. And we have D, which means drugs. So drugs like aspirin, NSAIDs, beta blockers also lead to asthma. Then we have O, which is occupational exposure. So the cotton dust or any kind of chemical fumes lead to this asthma. Then we have C, which is the emotional conditions. So the stress, anxiety, or any kind of strong emotions will lead to this asthma. And that's great dog. The easiest way to remember the etiology of asthma. Now let's try to understand the pathophysiology of asthma in the easiest way. So first imagine that a person who is genetically prone to asthma. So now when this person got exposed to the environmental triggers, that can be dust, pollen, smoke, or any kind of allergens or irritants. So what happened? His immune system got activated. When his immune system got activated, the immune cells like mast cells, eosinophils, and T helper cells got activated. Because of this, there was a release of certain inflammatory chemicals. So those inflammatory chemicals are histamine, leukotrienes, and prostaglandins. Now these chemicals will be causing the inflammation of the airways. When this inflammation occurs, they will be making the airway more sensitive and also more swollen. Due to this, at the same time, the airway lining also becomes swollen, which is called as mucosal edema. The lungs produce more mucus than usual. Now think about it. There was swelling, tightened muscles, and excessive mucus. All happen together. Because of this, the airway becomes narrow, making it difficult for the air to pass. As airflow decreases, the patient will be developing certain classic symptoms like wheezing, breathlessness, chest tightness, and cough. So in one line, just remember this flow. Because of genetics or any kind of triggers, the immune system got activated, due to which there was a release of the inflammatory mediators, due to which the airway inflammation has happened. This led to the bronchoconstriction, leading to the excessive mucus secretion, thereby causing the narrowing of the airways, due to which the airflow got reduced, thereby leading to the asthma symptoms. So that's the complete pathophysiology of asthma. So coming back to the clinical presentation of asthma, just remember a simple code, that is CWB and CA, where C means it is cough, W means it is wheeze, B means it is breathlessness, C means it is chest tightness, A means it is associated symptoms. So cough means what? In this asthma condition, there will be persistent cough or recurrent cough, and usually this cough will be worsening at the night or sometimes in the early morning. So this cough, it can be dry, or sometimes it can also produce the mucus. And coming to the second one, which is wheezing. So what is wheezing? Simply in this asthma condition, there will be high pitched whistling sound that will be heard during the breathing, and this is mainly caused because of the narrowing of the airways. And the third one is breathlessness. So breathlessness means simply there will be dyspnea condition, which is simply the difficulty in breathing. And coming to the next one, which is chest tightness can be seen. And also there are certain variable symptoms which will be usually episodic, like there will be on and off episodic symptoms can be seen. Then we have A, which is associated symptoms, any kind of associated history, like if any of the family member is having the history of asthma, in such conditions this can occur. Let's learn the diagnosis of asthma in just 2 minutes. So coming back to the diagnosis, so doctors diagnose asthma step by step. So first one is by the clinical evaluation. First, doctor asks about the symptoms like wheezing, breathlessness, chest tightness and cough. So they also ask about the family history and whether the symptoms are triggered by any kind of dust or pollen or cold air or any kind of exercise. So, spirometry is the gold standard test for identifying this asthma. So, this is one of the most important tests, and this will be measuring how well the lungs are working by checking the FEV1 and FEC and also this ratio. And this FEV1 and FEC ratio, usually it is decreased in case of asthma. That will be showing the airway obstruction. So the third one is the bronchodilator reversibility test. In this condition, usually the patient performs spirometry first. After that, the bronchodilator inhaler will be given. Again, the spirometry will be given for 10 to 15 minutes. After giving this, if this FEV1 is increasing by at least 12% or 200 ml, it means the airway obstruction is reversible. So that will be supporting the asthma. And the fourth one is the peak expiratory flow, that is PEF value. So this test usually measures the how fast a person can blow out the air from the lungs. Will be telling the maximum speed of expiration, and also the main uses of this is that this can be measured. Home monitoring is possible. You can check the treatment response, you can check the disease severity, and also detect the day to day changes. And the last one is the additional investigations. So additional investigations, like if needed, doctors may do the chest x-ray. They can do allergic testing by identifying the blood eosinophil count or sometimes FeNO ratio. This test will be supporting the diagnosis and rule out the other conditions. So what is FeNO? It is simply the fractional exhaled nitric oxide. This will be performed if available. So that's the end of part 1. So today we understood what asthma is, why it happens, how it develops, and its symptoms and how it's diagnosed. But here is the real question. How do we treat asthma? Which inhalers should we use? Why inhalers are better than tablets? We will cover all of that in our next video on asthma treatment and management. If this video helped you, like the video, share it with your study partner, and subscribe to Pharma Palette for simple and exam focused pharmacy content. See you all in the next video. Thanks for watching.